Today I will be recording my Module 8 Pharmacological Considerations within the Community. All Aspen students are required to abide by Aspen's University Academic Integrity Policy as outlined in the University Catalog. The Academic Integrity Policy is built upon the concepts of honesty, truth, fairness, respect, and responsibility. By taking this assessment, I agreed to abide by both the Academic Integrity Policy and the rules outlined in this assessment within this recording. I'm attesting that I have personally completed the proctored assessment and that the information I submit is true and accurate to the best of my knowledge. Beginning with slide number 1, I have my objectives. Identify medications used for common community diagnoses, outline the pathophysiology of the prescribed medications, compare and contrast medication types, identify alternative medications for each diagnosis, and explore the mechanism of action of the prescribed medication. For the first focused exam, UTI with antibiotic sensitivity. For the shadow health assessment, the patient was a 21-year-old female, presented with urinary frequency and burning for 3 days. She endorses some lower abdominal cramping, has one regular sexual partner, and has an allergy to penicillin. The patient's urine dipstick was positive for both leukocytes and nitrates, and her pregnancy test was negative. After evaluating the patient's symptoms, 2 medications were prescribed for optimal relief: nitrofurantoin and phenocyparidine. Nitrofurantoin is an antibiotic primarily used for the treatment and prevention of lower urinary tract infections such as cystitis. It is not effective for treating upper urinary tract infections such as pyelonephritis due to its poor tissue penetration. Pharmacokinetically, the drug is well absorbed when taken orally, with increased bioavailability when administered with food. It has limited distribution in body tissue, but concentrates effectively in the urine, which is the main site of action. Nitrofurantoin is primarily metabolized in the liver and primarily excreted via the kidneys in an active form. The pharmacodynamics of nitrofurantoin involve bacterial uptake and enzymatic reduction by flavoproteins, which generate reactive intermediates. These intermediates damage bacterial DNA, ribosomal proteins, and other macromolecules, ultimately resulting in bacterial cell death. This mechanism makes nitrofurantoin a targeted and effective option for managing uncomplicated urinary tract infections. The second medication is phenocyparidine. It's a urinary tract analgesia, commonly used to provide short-term relief from symptoms associated with lower urinary tract infections and irritation. These symptoms include burning pain and pain during urination, which is dysuria, urgency, and increased frequency, which may result from infection, trauma, or post-urologic procedures. Phenocyparidine is not an antibiotic and does not treat the underlying cause of urinary discomfort, but instead offers symptomatic relief. Pharmacokinetically, phenocyparidine is rapidly absorbed from the gastrointestinal tract and distributed systemically. Though its therapeutic action is localized to the urinary tract mucosa, it is partially metabolized by the liver and primarily excreted by the kidneys into the urine, where it becomes active. While the precise mechanism of action is unknown, it is believed to function as a local analgesic or anesthetic, soothing the mucosal lining of the urinary tract. Due to its mechanism and site of action, it is often used alongside antibiotics, with its use limited to a maximum of 2 days to avoid masking symptoms of more serious infections. Outlined above are the monitoring parameters and success. When prescribing nitrofurantoin, careful monitoring is essential to ensure safety and effectiveness. Renal function should be assessed prior to and during treatment, and the drug is primarily excreted through the kidneys and is contraindicated in patients with a creatinine clearance below 30 mL per minute. Inadequate renal function can lead to drug accumulation and increased toxicity while reducing therapeutic effectiveness. For patients on long-term or prophylactic use, liver function tests should be monitored due to the risk of hepatotoxicity, and any signs of pulmonary toxicity such as persistent cough or shortness of breath should be investigated immediately, especially since chronic pulmonary reactions can occur with prolonged therapy. Additionally, patients should be observed for signs of peripheral neuropathy, including numbness or tingling in the extremities, particularly in those with predisposing conditions like diabetes. For phenocyparidine monitoring, focuses primarily on renal function, especially in elderly patients with those with pre-existing kidney impairments. It should be used with caution in individuals with a creatinine clearance below 50 mL per minute due to the risk of drug accumulation and increased side effects. Because this medication is not a curative agent but rather symptomatic treatment, it should be limited to no more than 2 days in combination with antibiotics to avoid masking symptoms of a worsening infection. Drug interactions and considerations. Nitrofurantoin has several notable drug interactions that make affect its absorption, excretion, and overall effectiveness. When taken with probenecide or sulfapyrazone, both of which are uricosuric agents, there's a significant reduction in renal excretion or nitrofurantoin. This leads to increased blood levels of the drug, which raises the risk of toxicity without enhancing its urinary antibacterial effect. Additionally, antacids containing magnesium trisalate can interfere with the gastrointestinal absorption of nitrofurantoin, leading to reduced therapeutic efficacy. Because it is an antibiotic, nitrofurantoin may also interact with live bacterial vaccines, such as oral typhoid vaccine, potentially reducing the vaccine's effectiveness. It is generally recommended to avoid administering live vaccines during or shortly after antibiotic therapy. Phenylpyridine, although not an antibiotic, also presents with few interactions. One of the most common issues is the ability to interfere with urine dipstick tests, particularly for glucose and ketones. This is due to the intense orange or red discoloration it causes the urine, which can affect the colorimetric readings on these tests, which can lead to inaccurate results. In patients with renal impairment, concurrent use of phenylpyridine with other nephrotoxic agents should be approached with caution, as it may increase the risk of kidney toxicity due to reduced drug clearance. Patient education includes nitrofurantoin can cause some GI upset, so is recommended to take with food, can cause headaches, dizziness, serious pulmonary toxicity, liver injury, and neuropathy. You should educate the patients on the complete course, report breathing issues, jaundice, and numbness. For phenylpyridine, it can cause orange/red colored urine, headaches, and GI upset. Some serious side effects are hemolysis and methylglobin. Educate on short-term use only, not to cure or report fatigue or skin yellowing. The next focused assessment is community-acquired pneumonia. The medications prescribed for amoxicillin glycolate and doxycycline, and here are the overview and indications for the medication. For the specific Shadow Health focused assessment, the patient is a 72-year-old African-American woman who presented with a 3-day history of chest pain, cough, fatigue, and fever. The patient attempted to relieve her symptoms with aspirin and rest without success. She received the pneumococcal vaccine 12 years ago and the influenza vaccine 3 months ago. She denies a history of smoking or allergies and has been taking her home medication as prescribed. After evaluating the patient's symptoms, a 7-day course of amoxicillin glycolate along with a 5-day course of doxycycline was prescribed. Amoxicillin glycolate is a combination of a beta-lactam antibiotic and a beta-lactamase inhibitor used to treat a wide range of bacterial infections such as sinusitis, otitis media, pneumonia, skin infections, and urinary tract infections. Amoxicillin inhibits bacterial cell wall synthesis by targeting penicillin-binding proteins, while glycolate inhibits beta-lactamase enzymes, preventing bacterial resistance. It is well absorbed orally, especially in food, widely distributed in the tissues, partially metabolized in the liver, and excreted primarily via the kidneys. Drug interactions include reduced efficacy of oral contraceptives, increased bleeding with warfarin, and rash when combined with allopurinol. Monitoring includes renal and hepatic function. Side effects include gastrointestinal upset, rash, and rarely serious allergic reactions or C. difficile colitis. Doxycycline is a tetracycline class antibiotic. It is often used for respiratory infections, acne, and sexually transmitted infections, Lyme disease, and tick-borne illnesses. It works by binding to the 30-ribosome subunit, inhibiting bacterial protein synthesis, and ultimately halting bacterial growth. Doxycycline has excellent oral absorption, is widely distributed in the tissues, minimally metabolized in the liver, excreted primarily to feces and urine. It interacts with acids, iron, calcium, and magnesium, which reduces that absorption and may also potentiate the effects of warfarin. In terms of pharmacogenetics, it has minimal known genetic variability, but caution is advised in pregnant women and children under the age of 8 due to tooth discoloration. Monitoring includes liver and renal function with prolonged use. Side effects include GI upset, photosensitivity, and esophagitis. Outline of the mechanism of action. For this specific medication, amoxicillin glycolate and doxycycline differ in their mechanisms of action and antibacterial effects. Amoxicillin targets bacterial cell wall synthesis by binding to penicillin-binding proteins, leading to cell lysis, which glycolate inhibits beta-lactamase enzymes, enhancing amoxicillin's effectiveness. This combination is bactericidal, meaning it kills bacteria directly. In contrast, doxycycline binds to the 30-ribosomal subunit, as mentioned in the previous slide, inhibiting protein synthesis and preventing bacterial replication, making it bacteriostatic. While both are effective against a broad range of infections, amoxicillin glycolate is often used for respiratory and urinary tract infections, where doxycycline is preferred for atypical pathogens, tick-borne illnesses, and acne. Patient education for these two specific medications includes making sure you take it with food to reduce stomach upset and improve absorption, complete the full course of antibiotics even if symptoms improve to prevent resistance, and watch for allergic reactions such as rash, swelling, difficulty breathing, and to make sure you seek medical attention if any of these occur. With doxycycline, the patient education is quite similar, but you want to make sure you take it with a full glass of water and sit upright for 30 minutes to prevent esophageal irritation. You want to avoid dairy, antacids, and supplements containing calcium, magnesium, or iron around dosing to ensure proper absorption, and protect yourself from sunlight by using sunscreen and wearing protective clothing due to the photosensitivity risk. An alternative drug therapy for this diagnosis is levofloxacin, which is a fluoroquinoline antibiotic commonly used as an alternative treatment for community-acquired pneumonia. It has excellent oral bioavailability, and it distributes widely throughout the body, including lung tissue. Levofloxacin works by inhibiting bacterial enzyme DNA gyrase and topoimerase 5, which are essential for DNA replication and repair, resulting in bacterial cell death. It is primarily excreted by the kidneys, requiring dose adjustment in patients with renal impairment. Levofloxacin interacts with antacids and mineral supplements such as calcium and magnesium, which can reduce its absorption, and it may increase the risk for QT interval prolongation when combined with other QT prolonging medications. Patients on warfarin should be monitored closely for bleeding risks. Monitoring includes renal function, signs of tendinitis or tendon rupture, especially in older adults or those taking corticosteroids, and cardiac assessment in patients who are at risk for arrhythmias. Successful treatment is indicated by improvement in respiratory symptoms, fever resolution within 48 to 72 hours, and improvement in the chest X-ray post-medication administration. Side effects range from common gastrointestinal symptoms like nausea and diarrhea to serious risks such as tendon rupture, QT prolongation, peripheral neuropathy, and central nervous system effects. Patients should be educated to avoid antacids or mineral supplements, close to dosing times, report any tendon pain immediately, and complete the full course of therapy and protect themselves from excessive exposure to the sun due to photosensitivity. The next focused exam is pain. The patient is a 30-year-old transgender man who presented with a 3.5-month history of lower back pain after lifting a heavy box. He reports regular acetaminophen use with minimal relief and has been using his friend's hydrocodone medication. He reports walking, bending, lifting aggravates the pain, while sitting provides some relief. The patient was prescribed ibuprofen, which is a non-steroidal anti-inflammatory drug, and said commonly used to relieve mild to moderate pain, reduce inflammation, and lower fever. It is well absorbed orally, reaching peak levels within 1 to 2 hours. It is highly protein bound in the bloodstream. The drug is extensively metabolized in the liver and primarily excreted by the kidneys. Ibuprofen is frequently used for conditions such as arthritis, headaches, and musculoskeletal pain. Patients should be aware of potential drug interactions, including increased bleeding risk when taken with anticoagulants, reduced effectiveness of some blood pressure medications like ACE inhibitors and diuretics, and heightened risk of kidney damage when combined with other NSAIDs. Monitoring should include kidney function, blood pressure, and signs of gastrointestinal bleeding, such as black stools or abdominal pain. Success is indicated by reduced symptoms and improved motility and mobility. Common side effects include gastrointestinal upset and nausea, while serious risks include gastrointestinal bleeding, kidney impairment, and cardiovascular issues, especially with long-term use. Patients should take ibuprofen with food or milk to minimize stomach irritation and avoid alcohol to reduce bleeding risk, adhere to prescribed doses and duration, and promptly report any severe abdominal pain or unusual bleeding. On this slide, the mechanism of action is outlined. Ibuprofen works by inhibiting cycloogenase enzyme COX1 and COX2, which are responsible for producing prostaglandins. Prostaglandins cause inflammation, pain, and fever. By reducing their production, ibuprofen effectively decreases inflammation, relieves pain, and lowers fever in the body. The alternative drug that I chose was naproxen. Naproxen is a non-steroidal anti-inflammatory drug commonly used to treat mild to moderate pain, inflammation, and fever, including conditions such as arthritis and musculoskeletal pain. It is well absorbed when taken orally, reaching peak plasma levels within 2 to 4 hours. It is highly protein bound in the bloodstream. Naproxen is primarily metabolized in the liver and excreted mainly through the urine as metabolites. Naproxen can interact with other medications, including anticoagulants, increasing bleeding risk, and may reduce the effectiveness of antihypertensive drugs like ACE inhibitors and diuretics. Patients taking naproxen should be monitored for kidney function, blood pressure, and signs of gastrointestinal bleeding or ulcers. Common side effects include gastrointestinal discomfort, nausea, and dyspepsia, while serious side effects may involve GI bleeding, kidney impairment, and increased cardiovascular risk with long-term use. Patients should take naproxen with food or milk to minimize stomach irritation, avoid alcohol and smoking to lower bleeding risk, and adhere strictly to prescribed dosages. The next focused exam is hypertension and type 2 diabetes. The medications prescribed are glipizide, metformin, and the overview and indications are listed here in the chart to the left. The patient who presented is a 38-year-old male who came to the clinic with a history of hypertension and diabetes. He does not regularly monitor blood sugar and endorses increased thirst and urination. He reports being under financial constraint and has been eating poorly. He reports a sedentary lifestyle and a recent 15-pound weight gain. On assessment, the patient is vitally stable. His recent fasting glucose is 210 milligrams per deciliter with an A1C of 9.3%. The patient was prescribed a glipizide-metformin combination for diabetes management and lisinopril hydrochloride for blood pressure and weight management. Glipizide-metformin is a combination oral medication used to manage type 2 diabetes when single-agent therapy is inadequate. Glipizide sulfonylurea increases insulin secretion from pancreatic B cells, while metformin ubiquinone reduces hepatic glucose production and improves insulin sensitivity. It is recommended to take with meals to reduce gastrointestinal side effects and prevent hypoglycemia. Common side effects include nausea, diarrhea, and low blood sugar. Serious risks include lactic acidosis from metformin and severe hypoglycemia from the glipizide. Monitoring includes keeping track of your blood glucose, your HbA1c, and renal function. Patients should avoid alcohol and temporarily stop metformin before contrast imaging to reduce the risk of lactic acidosis. I'll review lisinopril hydrochlorothiazide, which is a combination drug used to treat hypertension, especially when monotherapy is ineffective. Lisinopril is an ACE inhibitor that relaxes blood vessels by blocking angiotensin II formation, while hydrochlorothiazide is a thiazide diuretic that reduces fluid volume by increasing urinary sodium and water excretion. This dual action lowers blood pressure and reduces cardiovascular risk. Common side effects include dizziness, dry cough, and increased urination. Serious risks include hyperkalemia, hypotension, and renal impairment. Electrolytes, kidney function, and blood pressure should be monitored regularly. Patients should stay hydrated, avoid potassium supplements, and report swelling, cough, or a feeling of lightheadedness promptly. The monitoring parameters for both medications are listed in the table to the left. I will outline them below as well. So for patients taking glipizide and metformin, the most important monitoring parameters include fasting and postprandial blood pressure and glucose levels to assess daily glycemic control and HbA1c every 3 to 6 months to evaluate long-term glycemic management. It is also essential to monitor renal function, which includes your eGFR, BUN, and creatinine, since metformin is renal excreted and poses a risk for lactic acidosis and impaired kidney function. Lisinopril hydrochlorothiazide monitoring should focus on blood pressure to ensure therapeutic effectiveness, as well as renal function and serum electrolytes, particularly sodium and potassium, since both the ACE inhibitor and thiazide diuretic can impact kidney function and electrolyte balance. Patient education includes take with glipizide and metformin should be taken with food to prevent stomach upset. You want to watch for signs and symptoms of hypoglycemia and avoid alcohol. For lisinopril and hydrochlorothiazide, you want to take in the morning to reduce nighttime urination, avoid potassium supplements and salt substitutes, and report a persistent cough and swelling of the face and neck. Alternative drug therapy that I chose for a substitute for glipizide and metformin is the GLP-1 receptor agonist like liraglutide, which enhances insulin secretion and slows gastric emptying to promote weight loss. And for lisinopril and hydrochlorothiazide, I choose an angiotensin II receptor blocker, losartan, which is like an ACE inhibitor but less side effects, including a cough. The liraglutide is a GLP-1 receptor agonist used to treat type 2 diabetes and reduce cardiovascular risk. It is administered as a once-daily subcutaneous injection. It stimulates insulin secretion and suppresses glucagon in a glucose-dependent manner, slowing gastric emptying and promoting weight loss. Common side effects include nausea, gastrointestinal upset, injection site reactions. It can increase hypoglycemic risk when combined with insulin or sulfonylureas. Patients should be monitoring their blood glucose, their HbA1c, their weight, and watch for abdominal pain. Losartan is an angiotensin II receptor blocker and is taken orally for hypertension, diabetic neuropathy, and heart failure. It blocks angiotensin II receptors, causing vasodilation, reducing aldosterone-mediated sodium retention. It's metabolized by the CYP2C9 and CYP3A4 and it has a half-life of 2 to 9 hours. Monitoring includes blood pressure, serum electrolytes, especially potassium, and renal function. Side effects can include dizziness, hypotension, hyperkalemia. Both medications require regular follow-up for safety and efficacy. The next focused assessment is COPD. The patient is a 55-year-old female who presented to the clinic with worsening COPD symptoms, bronchospasms, and a history of smoking with a desire to quit. The patient reports a history of coughing fits with sputum production and increased fatigue over the last 2 weeks. The patient used formoterol inhalers at baseline with little effectiveness. She presented today for assessment for her COPD exacerbation and medication for smoking cessation. She is vitally stable and has a COPD assessment score of 17. After assessing the patient with her current symptoms, she was prescribed 2 medications to help with symptom relief and an additional medication to help with smoking cessation. The first medication that was prescribed was tiotropium, which is a long-acting muscarinic antagonist, or LAMA, used as a maintenance therapy for COPD and sometimes asthma. It works by blocking M3 receptors in airway smooth muscles, leading to bronchodilation. Administered via a dry powder inhaler, it has a long duration of action with minimal systemic absorption. Common side effects include dry mouth, cough, and throat irritation. Patients should use it daily, not for acute relief, and inhale deeply during administration. Rinsing the mouth after can reduce dryness, and you want to monitor for symptom control and report any urinary retention, vision changes, or worsening breathing symptoms. The second medication prescribed was ipratropium bromide with albuterol, which is a combination bronchodilator used for quick relief of asthma and maintenance in COPD. Ipratropium is a short-acting muscarinic antagonist, while albuterol is a short-acting beta-2 antagonist. Together, they relax muscle airways via different pathways to improve breathing. It is essential and is usually inhaled via nebulized or metered-dose inhaler. Onset is rapid, with effects lasting 4 to 6 hours. Common side effects include dry mouth, shakiness, palpitations, and cough. Patients should use this prescribed for symptom relief and avoid overuse. You want to monitor your respiratory symptoms, heart rate, and signs of paradoxical bronchospasms or urinary retention. The next medication is varenicline, which is used as a prescription medication to help individuals quit smoking. It works as a partial agonist at nicotinic acetylcholic receptors, reducing nicotine cravings and withdrawal symptoms. We're also blocking the effects of smoking. Taken orally, it is usually started 1 week before a planned quit date. Common side effects include nausea, insomnia, vivid dreams, and headaches. Rarely mood or behavior changes may occur. Patients should take it after eating with a full glass of water to reduce nausea. Success is monitored through smoking reduction and adherence to the quit plan. Patient education includes teaching patients to inhale deeply and steadily through the device and to use it daily. The patient should rinse their mouth after to avoid and reduce dry mouth and the potential risk of thrush. With ipratropium albuterol, instruct patients to use it as directed for symptom relief, avoid overuse, and report chest pain, tremors, or difficulty breathing. Emphasize correct inhaler techniques for varenicline, otherwise taking it with food and water to reduce nausea, setting a quit date, and following the dosing schedule. Warn about vivid dreams and possible mood changes, and encourage prompt reporting of any psychological symptoms during the therapy. Alternative drug therapy that I chose In relation to the respiratory aspect of this focused assessment is levobuterol, which is a short-acting beta-2 agonist used for quick relief of bronchospasms and COPD. It relaxes airway muscles by stimulating B2 receptors with effects starting in 15 minutes and lasting 4 to 6 hours. It is important to watch for interactions with beta blockers and monitor heart rate side effects, including tremors and headache. Patients should only use as needed and learn proper inhaler technique. Another medication is Trelegy Ellipta, which is a once-daily inhaler combination, mixing an inhaled corticosteroid and a long-acting beta-2 agonist and a muscarinic antagonist. It reduces inflammation and provides sustained bronchodilation to improve lung function and prevent exacerbation. Monitoring lung function and side effects like oral thrush are important. Patients should use it daily and rinse their mouth after use. An alternative drug therapy for smoking cessation includes NRT or nicotine replacement therapy, including patches, gum, lozenges, nasal sprays, and inhalers, which are all designed to help people quit by delivering controlled doses of nicotine. Depending on the form, nicotine is absorbed slowly, patches, which is patches, or quickly, which is the nasal sprays and inhaler, and is metabolized mainly by the liver enzyme, and with genetic variations potentially affecting responses. Nicotine works by binding to nicotinic acetylcholic receptors in the brain, stimulating dopamine releasing to reduce cravings and withdrawal symptoms. Monitoring involves tracking smoking cessation progress, adherence, and side effects such as skin irritation or throat discomfort. Patients should use NRT as directed, avoid smoking during therapy, following dosing schedules, and report any adverse effects. The following slides outline all of the references used for this presentation, and thank you for listening.